my personal endocrinologist, 20, 30 medication prior auths a week. She only needs to, log on at the end of the week, for example, and just check a couple of things. We're actually the only medication prior auth solution that's built into Athena and natively integrated on their marketplace. And so that's quite an exciting place to be. Really what we're doing is we're handling 100% of PAs for 100% of providers for 100% of payers across all channels. Because I think that's what a clinic needs to know when they install a tool like that.
Nico, thank you so much for hopping on the podcast today. For the listeners, we have Nico Kernick, Head of Growth at Develop Health. Nico, thanks for joining us.
Thanks, Bert. Good to be with you, and thanks for having me on.
Yeah, likewise. And all right, well, for the listeners, I think at least I was personally very interested in the work you guys are doing at Develop Health around AI-assisted prior auth. But let's dig into your background first. You have a very interesting background yourself from your consulting days with BCG to now diving into work with healthcare and prior auth. What sort of pulled you into healthcare, and why did prior auth stand out to you as a problem worth solving?
Yeah, it was an accident.
It was an accident.
Really, I think it became extremely clear once I started looking into it that it would be a good place for me to work, and where there were lots of fresh challenges. But it wasn't something that I dreamed of from a very young age. I actually studied theoretical physics in the UK, and coming out of that, I went into consulting really purely based on the challenge. I think consulting is just a place where you can have a new project every couple of weeks, a new team, new questions, new analysis that needs to be done, etc. And that was really exciting to me. So I actually ended up spending about 10 years at BCG, interspersed with doing my MBA coming over to the US. And then since about 2017, I've been in the US. And if you live in the US, you quickly realize that the industry with the most challenges is healthcare. Yeah. It's not necessarily the same in a lot of other places in the world, but the US has a health system with a lot of great outcomes and a lot of big problems and a lot of big challenges for a lot of people. And so it became apparent that was somewhere that I'd enjoy sort of sinking my teeth into. When I left BCG, I ended up going to a startup called Sandbox AQ and worked on go-to-market specifically related to pharma companies. And that's what got me interested ultimately in Develop Health at quite an early stage, who are really trying to reduce the friction between all of the players in the healthcare system. That's the best way to talk about it. The friction between payers, pharma companies, patients, and providers. By reducing that friction, people get better care. There's less money wasted, less time wasted. And that felt like a really interesting and exciting mission, while keeping up the theme of being very, very challenging, which is what I've always enjoyed in my life and in my career.
Yeah, right on. Yeah, I think I can relate to you very much on the consulting background as a former Accenture consultant, and I dug into the healthcare industry and the startup world like yourself. Now I would love to learn a little bit more about how you guys tackle this problem of prior auth at Develop Health in healthcare, right? It's one, like you said, there's so many problems in healthcare. It's 1/5 of our economy. A lot of people don't know that, which that's a true fact and growing. This has been I think prior authorization has been a problem for years, and now even there's been a regulation around the CMS requiring payers to even release their prior auth metrics. So now, and I think that deadline was in March of this year. So it's top of mind for a lot of folks, but how are you guys at Develop Health solving this problem of prior auth differently? Why is that valuable for the larger healthcare industry?
Yeah, and before I answer that exact question, I'd love to just touch on the problem of prior auth, as you put it, because I would just refine that a tiny bit and say it's the problem of friction with prior auth. A prior auth in and of itself, I don't have a problem with. I think it makes a lot of sense that, if you have an insurance, then in order to make a claim, let's say, the insurance wants to make sure that there's the right backing for that claim, right? If you just think even outside of healthcare, it's fair enough that if you have a car crash and you want to claim on your car insurance, that you're going to send a picture of your crashed car to show that indeed you did crash your car. And so similarly, I think it's totally fair that a payer wants to make sure that they are supporting their patients in the way that makes sense for them when they have the requirements that make sense for that particular drug, right? I think what's really tricky and where there's problems is really in a lot of the friction that's caused by the fact that that process gets done by hundreds of different payers across hundreds of different providers, across thousands of different drugs, across multiple different channels, and with obviously a bunch of different requirements and things. That's just like a huge kind of logistical nightmare, basically, across all those different parties. And that's where there's a lot of friction, which historically is, resulted in people sending faxes, writing letters, which can take weeks and really delay patient care. And that's really the friction that we're here to solve. So then what's been the sort of history of solving that friction, right? I think Cover My Meds has done an absolutely incredible job of taking what was historically a very fax-based process and turning most of it electronic and creating the NCPDP standard, for example, which has been adopted broadly. And that and other measures are what constitute the CMS ruling, for example, about trying to get payers to open up so that there's a more transparent prior auth process. I think everyone supports that, and that's really, really great for the whole industry. Now, where are there still problems? The problems that remain are still that not everyone is on EPA. Not everyone is using that protocol. There is still a lot of fax submission. There is still a lot of portal submission. Even with this ruling, there will still be a lot of those submission points of friction. And additionally, even with ideal transmission, providers still need to fill in forms. They still need to find in the EHR the information for the patient, etc., which makes it much harder to submit PAs for them. Providers don't get paid for the additional staff that they need to bring on to fill in PAs, right? And so it's really just a big burden on provider offices, especially on smaller provider offices that often can't fund that. And that's really a kind of a key part of the friction. That isn't a key part of the PA solution. It's a key part of the friction. A provider needs to manually go through all of this effort.
Yeah, well said. I think that's a great distinction. Like, it's not so much the problem is prior auth, but it's more like the friction you said with the process for the parties involved, that be providers, the payers, a bunch of different classes of drugs, different requirements for, various EHRs. Now, knowing that there's a problem with friction, how have you guys tried to approach it differently? Knowing especially that, if we just take like providers, they have different EHR workflows, right? Like the workflow for an Athenahealth is much different from what it is for Oracle's, Oracle Health versus Epic, right? So how have you guys tried to kind of like solve that friction in the process?
Yeah. So our core product is sort of a suite of about 15 different LLM workflows. Those do different things. One workflow will fill in a form if you give it clinical information. Another workflow is good at passing out the right information from lab results. Another workflow is good at identifying which PBM we should contact based on your insurance information. So there's a sort of core tenet of about 15 different LLM workflows. And then on one side, we connect those workflows to providers through EHRs. On the other side, we connect those workflows to payers through direct, usually payer integrations that we have. And so that's really where I think there's a bit of a secret sauce, is being really good at developing fully automated workflows that truly lift the friction from providers' shoulders, and then being really good at connecting those to the providers and to their EHRs in their workflows, and being really good at connecting them to the payers so that you're effectively just creating a frictionless communication between the two.
Yeah.
Our product specifically sits within EHRs, uses APIs within EHRs. So if you're using us with an Epic, if you're using us with an Athena, you're able to have the PAs automatically triggered. We'll automatically pull the clinical information that we need for that patient. We'll automatically get the form from the PBM. And then only once we've collected all that information, filled in the form, checked our answers, and surfaced any potential areas where we think there might be incomplete information, that's when we alert you like, hey, here's a PA ready for your review. Check it out, hit submit, and we'll handle the rest. So we're really removing a lot of the back and forth of the pharmacy, a lot of the back and forth of provider staff going into the EHR by sort of doing all of that legwork for them, kicking it off proactively, filling for them, and then only surfacing it within the EHR when it's ready for review.
Well, wow. Okay. So it's like an end-to-end workflow from like form fill to like the submission of the prior auth, like end to end. Now, what I'm curious, like, I think everyone's heard of prior auth. Like you make a good point. Like the friction is the issue. What is exactly like driving the market demand and urgency from like the health system perspective, or let's say a provider down to like a medical practice? Like is it kind of like the AI like craze that's happening in the market? They're like, hey, we need to use LLMs to make our work more efficient. Like what would you say is driving a lot of that market demand and urgency to address this friction? We've known about it for years. Like what's driving it right now, would you say?
It's a really good question. I think the drive has been there for a while, but there hasn't been a solution that has been at the right sort of price point and with the right ability to scale to really be useful for all providers. I think if I think about the sort of range of providers, on the smallest end of the scale, like my personal endocrinologist is a one provider clinic,
right?
And she sort of handles some PAs herself and has like a part-time person that helps her on Friday afternoons. And she's like, great, I do like 20, 30 medication prior auths a week. And she's now using our product and she only needs to, log on at the end of the week, for example, and just check a couple of things rather than being continually like back and forth with the pharmacies and continually pulling information. So the need for her is like, hey, there's a whole chunk of the time of my week that I'm using, which is not serving patients directly, which I would just love to be able to take off my shoulders. And I still want to keep control over what's being submitted. And I still know exactly, how I'm caring for my patients. But there's just this like administrative work that isn't useful to anyone. So that's kind of what drives, like, let's say a small provider clinic is just, please get this load off my shoulders. When you go all the way to the other end, we have some health system customers who have teams of 15, 20 people who just sit and do prior authorizations, right? They'll collect all of the scripts across the whole health system, put them in one central place, and then have the teams work on them.
Wow, wonderful. Yeah, I love that personal anecdote with your own endocrinologist. It's really almost like these, like the advent of AI and these LLMs as they've gotten like smarter, and faster, more intelligent. It's made it more accessible to address this friction, like down to like solo physician practices all the way up to upstream to like health systems with teams that do this. Like it's made it more accessible almost. Would you like, that's kind of my interpretation of it to address this, friction in prior auth.
Yeah, I think that, Anthropic actually released a report talking about how this was one of the lowest hanging fruit in the world. Like dealing with documentation in healthcare is one of the lowest hanging fruit for AI to optimize. And the reason is that it's just like, it's a super high volume of documents, a super high amount of information that's a little bit irrelevant, but with like core nuggets that you care about. And AI is just really good and really quick at looking through all of that and structuring it in a way that's helpful. Now, what that means, I think, is that I think, someone could just take clinical information and take a form and put in the ChatGPT and it would do pretty well. But the truth is that to get it to be really good and really reliable and effectively learn from thousands of other PAs for that same drug, and to get that to work in a way that's connected with the providers and runs automatically with the information from the HR and connected to PBMs to actually submit that information, that's really where it gets difficult. So in this case, like AI is absolutely critical to what we do, but the complexity isn't the AI, actually. The complexity of building this company is the integrations on both sides and the workflows that we're building rather than the core AI, which is sort of, I guess the core AI is so good at this point, but that is just no longer a bottleneck for this sort of solution.
Right. Yeah, we're living in a wild time. And you said it best, right? Even with your own endocrinologist, like they were having to check with like different pharmacies week to week. And these automations with filling out documentation, you cited the Anthropic report. These have been around for years. I've been working in this industry since about 2018. And, these automations have been in place, but it's now with LLMs and agents, it's made it easier to orchestrate these things and plug into these different systems. Like something like prior auth is not just the provider and their documentation. Like you said, it pulls in the payer, the PBM, the pharmacy. Like you have to be able to orchestrate across various systems and multiple steps, and now
Totally.
that's a lot more accessible, at least from what I'm seeing in the market and companies like you guys at Develop Health. That I would love to now next like dig into some of the successes you guys have had, and on the point of systems, you have to start somewhere in healthcare, as we know, and the market is ripe with opportunity, but you have to start with certain systems, and you guys have already had a ton of success with both Athenahealth and Oracle Health, right? After Oracle acquired Cerner, you guys are live on both, from what I understand. I think I saw some metrics like you're processing over 500,000 patients a month. What have you guys like learned from this work with large EMR EHRs like Athena and Oracle?
Yeah, I mean, I think we've learned a lot from there, but we started as a company actually serving digital health. And so I think that's where we really kind of cut our teeth and built out our processes and created APIs for our tools, like for those core LLM workflows that make it relatively easy to plug into EHRs. So Athena, for example, is a very API-driven EHR, pretty flexible with a good marketplace setup and with a good customer base. And so that was just one of the first one that we sort of launched in January of this year, 26. The uptake's been really exciting. So I think we sort of decided to go to traditional provider clinics and start scaling our product so that more and more providers were using it. And we've now got a bunch of clinics on EHR that sort of span from like FQHCs to specialty clinics. My endocrinologist is on there, but we've got multiple hundred like provider sized groups on there, and we're actually the only like medication prior auth solution that's built into Athena and like natively integrated on their marketplace. And so that's quite an exciting place to be. And I think now we're actually so we're launching live on Epic with a couple of customers that we've signed on Epic now, which is exciting. And we'll hopefully be able to talk about publicly very soon. And through that, we'll also be able to get access to the showroom and hopefully be able to expand faster and faster to more Epic customers very soon. And additionally to that, we've actually been working on a universal integration that can help us get access to far more of the tail end of the EHRs, so that ideally we're just not leaving any providers behind here.
Yeah. Because I mean, that's fascinating, the scope that you guys are covering from Athena all the way now to your expansion on Epic, which we'll get to in a second. You mentioned you guys started by serving digital health. Has that sort of informed your guys' like strategy with all these like you called it tail end integrations, but there's so many different EHR EMR companies, right? Like, would you guys say your experience starting in digital health has informed that in any way?
I think it's informed it because we had to make a product that was extremely flexible for different environments. Digital health companies used to serving patients with very, very high demands, right? They need turnaround, like very high latency requirements. They need really fast response rates. They want the best turnaround times in determination in the business. They want the best approval rates, etc. Because often they charge the patient for the service, right? They're charging the patient for that back-end service, which a traditional provider isn't doing. So that quality bar meant that we developed a product that not only just performed very well, but could fit in Ro's own custom EMR, for example, could fit in Calibrate's custom EMR, could fit in Encompass's EMR. They've all got different requirements in terms of how insurance information flows in, how clinical information flows in, and how they want results showing up. And so we needed APIs that could plug in different ways there, which I think has made us just a very sort of flexible company that can now also serve specialty pharmacies or hubs or large health systems or small clinics. It's all the same core LLM workflows, reducing that friction, but with the different integration points.
Yeah, well said. Yeah, I was going to ask you for like an example, and I think the Ro example was sort of like covers it. It gave you guys almost this like outside in perspective from digital health, and now you're really going inside out with these EHRs that are really the core of a lot of these provider groups. Is like a lot of their work is done in these EHRs, like Athena, like Oracle Health, even smaller players, right? Like that are in the market, like Practice Fusion, Next Gen. There's so many of them, right?
There's so many of them, yeah. I think it's key to sort of explain a little bit how big the uplift here is, right? Like with some of our digital health customers who were using traditional hubs for prior authorizations, we've reduced average turnaround time from over a week and a half to less than a day across, and that's across EPA, but also other channels. So that's on average across all channels. We've increased approval rate on average by 14 percentage points. And we've drastically reduced the handling time for those teams. So they need to spend 80 to 90% less time actually working through forms and things. Yeah. So it's like a huge improvement for patients and for the companies that are trying to make, a business out of this as well.
Yeah. Yeah. Well said. It's the iron triangle of healthcare, like how do you improve cost, quality, and outcomes like all at once? And those are the solutions that win. And you guys, I think in a way are accomplishing that, with helping, the patients get more timely access to care, the provider, like improving, their outcomes of how fast they get these approved. And then also for the payers, so it makes a lot of sense. Now, I want to go back to the point you made about going live on Epic. I think, there's whole podcasts, I think, out there just focused on Epic, right? And their growth in the market. They're the number one EHR with the largest market share. Talk to me about like what is prompting your guys's, path to expand in the Epic ecosystem. And with Epic, they know they're the market leaders and they've been that for a while. Like, how are you guys in any ways approaching that expansion differently from other, integration partners you may have had?
I think Epic, you're absolutely right, have a lot of market share, and they have been extremely impressive with how they've been sort of converting customers right over. And so we've got a bunch of our outbound efforts sort of try and find people's EHRs when we reach out. And very often we'll call up and be like, oh, we thought you were on X EHR, and it turns out you're now on Epic. So we see that day to day. And I think, that's one thing that prompted it, is that it's just very clear that it's a large tranche of the market. So we want to be able to play in there. And it's a tranche of the market that's just, got a longer sales cycle. It's usually bigger systems or clinics that have slightly like more complex requirements to sort of sign up and start serving. And so that's why we didn't put it first, but that's why we absolutely do need to prioritize it and do need to have a good presence there. And I'm excited that we have signed our first couple and that we are sort of launching our existing product and now connecting it into their Epic instances. And it's not complicated. Like the APIs that we need, these health systems are already using, right? They've already got license from Epic. So it's really just a matter of sort of switching on those Fire APIs for us so that we can go in and read the clinical information. And so it's turning out to actually be a pretty smooth integration, I would say. And then I think within a few months, we should be able to take that success and get ourselves into the showroom, which is obviously Epic's place for sort of sharing different apps and things. Right. And hopefully that can be the start of a bit more growth within Epic as well.
Right. Okay. Interesting. Yeah, because it sounds like you guys have those like building blocks already. You mentioned earlier in the 15 different LLM workflows you have integrated, with various EHRs. I did read part of the technical specs is you guys have built this on Smart on Fire. So all these things make it easier to plug into the Epic ecosystem, would you say? Right.
Yeah, totally. We built with that in mind. So with that flexibility, and our co-founders actually come from healthcare. One of them was CTO and co-founder Rupa Health. And the other one was sort of chief product at Canvas Medical. So they deeply understand providers and they deeply understand EHRs and the APIs that drive those EHRs, etc. And so we've really built with those two things in mind, like the provider experience and how to plug into EHRs. And on the provider experience, it's really like minimize the workflow. Sometimes I show a demo to providers and I kind of feel a little bit empty inside because a provider doesn't see much of our product. The whole point is that we reduce friction and don't add any other friction. So we're not, constantly flashing up messages to the provider. It just happens in the background and their team just receives like filled in PAs. But that's really what providers want. They want this stuff to work and they want their team to spend less time on it.
Yeah. I would actually take that as a positive for them. They want to be able to spend more time with their patients, and not get caught up in the administrative burden that, that's a win, I think, for them. Like, sure, they they don't see a lot of the sausage making, you know, like with your guys' different LLM workflows. But if they get the outcome that they want and it lets them spend more time doing the work that they like doing, which is with their patients, I think it's a win, right?
Totally. Yeah. If you're using Excel and you ask it to do some calculations, you don't want to see how the calculations are made. You just want to see the result.
Right. Well said. Yeah. That's a good analogy.
That's what we're going for.
Now you mentioned going live eventually on the showroom. Let's future proof this a little bit. Like we get to that go live on showroom. What can what can Epic health systems like expect out of this? Like what would this experience look like? You mentioned you do demos, but just like high level, what does the experience look like working with Develop Health to address this friction of prior auth for Epic health systems specifically? What would that experience look like for them?
So typically customers are finding us in showroom or showroom equivalents and reach out, and we do schedule a quick demo to show you what the experience would be. And then from that point, we just need you to effectively install the app on the back end through the showroom and then give us access to the APIs. And as I've said, like typically all of the APIs that we need are already ones that are being used throughout the provider site. So that's pretty easy. And then all of the kind of flows of the product are already built and ready to go. So it's a pretty quick integration. We typically will start with a handful of providers and maybe a handful of delegates to whom their PAs are going. And then we can expand to more and more over time as you build confidence. But there's no sort of scale limit. And really what we're doing is we're handling 100% of PAs for 100% of providers, for 100% of payers across all channels. Because I think that's what a clinic needs to know when they install a tool like that. It's not like, hey, can you do 60% of my volume and then I'll do the hard bits. It's like, no, I'd love to give you all of my volume, please. And so that's really where we're focusing on, is like we do the easy stuff and we do the edge cases.
Yeah, well said. I mean, and I think so. Said another way, like you guys are able to use the existing, like you call it, Epic showroom, and also their APIs. Like this isn't like a custom API build. Like you guys are plugging into the APIs
Correct.
that are available already to these health systems that are Epic customers.
Yeah, APIs that are available, and to be clear, like APIs that are generally already in use. Like we're not going to ask you to sign up to 5 more APIs that you're not using already from Epic. These are very standard APIs that we're plugging into.
Right. Yeah, because I think when people hear like, "Hey, we work with Epic," there's always, I think historically when I've worked with some Epic teams like years ago, there's been always a concern around like, oh, custom development with Epic will take a lot of work. Like Epic wants you to use their showroom, their APIs, like the apps they've developed, right? So the fact that you guys are able to plug into that, I think, is very lucrative to some of these Epic health systems. This isn't like a custom development work.
We're here to make it really easy for people, right? We keep the scripts in-house for you. We don't ask anyone to send any scripts anywhere else. We don't change any provider behavior. And the integration is super easy from within Epic using Epic's APIs. So we really try and make it as easy as possible for health systems.
Very interesting. Yeah, you guys are using this model that's already proven in the market, but you guys are coming at it. Your co-founders, you said, have a lot of healthcare and digital health experience. So now I think that gives you guys a leg up in terms of being able to, fit into that market very quickly. And I think a lot of Epic health systems would appreciate hearing that. Like, it's free to get their integration online, free to use the product. You're using their APIs. So all that, I think, would put a smile on the face of CTOs and CIOs out there,
Totally.
And even like for smaller practices, like your endocrinologist, the physician leader, of the practice equally. So, and with that said, for the providers and health systems out there that may be listening to this conversation and are interested by what you've shared so far, what is the best way for them to engage with you and your team at Develop Health? And I always love asking this, like, what should they have in place before starting the conversation with you guys, if anything?
Nothing. If you have no good way to use to run your prior authorizations today, that's when you should most reach out. If you've got a great system, we can plug into it, but you don't really need anything. If you're already using Epic, you're going to be using the APIs that we need, and we can help your team. If it's a team of half an FTE, if it's a team of 25 FTEs doing prior authorizations, we can help make that process smoother, reduce a lot of the headache associated to it, and improve patient outcomes. And we can do that all at no cost. You can reach out to us on our website. We've got a contact us form there. You can ping me directly, Nico, Nico, at develophealth.ai. And we'll also be at a bunch of conferences and things over the next year. But let's get a demo in the books and let's get you to try this out. And we're excited to help out more and more providers with this solution.
Yeah, well said. No, and we'll make sure to link your contact us form and your email in the comments below. But Nico, it's been a pleasure speaking to you today. I'm really looking forward to seeing your guys' growth in the market. I think this plug and play solution to really address friction of prior auth is much needed. And I think a lot of health systems that may or may not be using Epic down to solo physician-led practices can really benefit from this. And yeah, really, really looking forward to keeping tabs on your guys' journey. And thanks for joining the podcast today and sharing the good work you guys are doing.
Yeah, it's been a real pleasure, Bert. Thanks for the time and looking forward to seeing you soon.
Yeah, likewise. Thanks, Nico.